My name is Dr. John Capelli, and I'm here today to talk to you about the appropriate time to when to start chronic dialysis treatments. The recommendation as to when to begin chronic dialysis is a clinical decision which is made by the physician in collaboration with his patient. It is not a decision that is based solely upon a number. In an effort to standardize treatment guidelines, as measured by the residual renal function, criteria were developed in the 1990s. The decision was made to develop guidelines based upon the function of the kidney and at the point at which the residual renal function hit a particular level, chronic dialysis treatments could be initiated. As a result of these standards, the DOKI guidelines came out with recommendations which developed the treatment levels at a glomerular filtration rate at 15 cc's per minute, at which chronic dialysis could be initiated. The treatment level of a glomerular filtration rate between 10 and 15 cc's per minute was considered to be early dialysis treatment, as opposed to glomerular filtration levels between 5 and 9 cc's per minute. And at these break points became the point of debate. In an effort to improve mortality rates, which was running around 25% in the country at that time, the conventional wisdom among nephrologists was that the initiation of treatments early would improve outcomes. It seemed reasonable to conclude that beginning dialysis early and lessening the uremic load and the associated comorbid conditions that were associated with uremia, it was not unreasonable to expect that outcomes could be improved. And actually, literature published between 1995 and 1998 did suggest such validity to these hypotheses. As a result, clinical practice was influenced. And the Renal Data Registry at that time demonstrated in published data that early dialysis treatments rose from 19% in 1995 to 45% in 2005. However, subsequent data published by the registry did not demonstrate any improvement in outcomes, but actually there may have been some worsening in the actual outcomes. Up until that time, there had not been any really well-controlled studies to address this question. And it was not until August of 2010, with the IDEAL study, the initiation of dialysis early versus late, that was published in the New England Journal by Dr. Cooper and Associates, that the question was answered. In a well-controlled study of some 800 patients, it was clearly shown that there was no statistical difference between the outcomes in patients initiating dialysis early as opposed to those initiating dialysis late. The study did indicate, however, that there was no adverse effect by beginning dialysis early, although there was an adverse effect felt to occur in patients upon their quality of life in the early treatment group. Chronic dialysis treatment is a life-changing event, and it should not be imposed until and unless it is absolutely necessary. There are several risks associated with dialysis. The stress of financial stresses, emotional stresses imposed upon the patient, the risk of infection, repeated hospitalizations, the acceleration of cardiovascular disease, the stress associated with access failures and repeated surgeries, just to name a few, not to mention the high cost added to the healthcare system. So the decision to begin dialysis should take into account the level of the patient's renal function in the context of their clinical symptomatology and associated comorbid conditions. I believe very firmly that very tight control of the patient with chronic renal disease, such things as maintaining good blood pressure control, maintenance of target hemoglobin A1C levels in the diabetic, maintenance of normal calcium homeostasis, maintaining a BUN of 80 milligrams per deciliter or less with good dietary control, tight management in the patient. Taking these things into context, one can effectively manage the patient with glomerular filtration rates less than 10 cc's per minute without any compromise. So that in the end, when the physician makes his recommendation to the patient that it is time to begin chronic dialysis, the patient can feel comfortable that it is the appropriate decision.